This video explains how the implantable telescope technology works and is not a full description of Vision Care's implantable miniature telescope utilized in the CentraSight treatment program. For more information on the risks and benefits of this implant, please read the patient information booklet at www.centrasight.com and discuss it with your doctor. Our vision is instrumental in connecting us to our surrounding environment, but our vision can degrade and worsen over time, sometimes due to diseases affecting the back of the eye. One such disease, age-related macular degeneration, or AMD, accounts for many new cases of blindness each year. The most advanced form of the disease, known as end-stage AMD, causes central blindness, which can make it very difficult or impossible to carry out many daily activities, such as reading, watching television, or even recognizing friends. Today, a new treatment program is available for those affected with end-stage AMD. The CentraSight treatment program utilizes a telescope implant, which has been shown to be safe and effective to improve vision in candidate patients through clinical trials and is an FDA-approved medical device. The telescope implant, about the size of a pea, is implanted into the eye after removal of the natural lens. A viewed image enters through the telescope implant, where it is magnified and projected onto healthy areas of the retina. It is this area around the macula not affected by AMD that the telescope uses to help improve straight-ahead central vision. If you have been diagnosed with end-stage AMD, the telescope implant used in the CentraSight treatment program could improve your vision and reconnect you to the things you love to see and do. The CentraSight treatment program involves 4 steps that start with diagnosis and continue after surgery. To be considered as a possible candidate for the treatment, you must first be examined by a retina specialist to confirm whether you have end-stage AMD. Your retina specialist will explain the benefits and risks of the CentraSight treatment program and answer any questions you may have. Next, you will be evaluated to see if you are likely to benefit from the telescope implantation surgical procedure, and if so, which eye is best suited for treatment. This candidate screening includes testing your vision using external telescope simulators. The results of these tests can help give you and your CentraSight team a good idea of what your vision may be like after the telescope implantation surgery, and if the effect of the magnification in one eye will be useful to you. Following a successful screening, the next step in your treatment program, should you decide, is to receive the telescope implant. The telescope implantation surgical procedure is performed on only one eye. It involves removing the eye's natural lens and replacing it with a tiny telescope implant. This part of the treatment process is done in a relatively short outpatient surgery by a specially trained ophthalmologist. You won't have to stay in a hospital and will return home the same day. After you have recovered from surgery, specially trained low-vision optometrists and occupational therapists will work with you to prescribe eyeglasses and complete your rehabilitation to help you adapt to and learn how to use your new vision in daily life. Following your surgery, you will be able to use natural eye movements to see things that are close and far away, such as reading printed materials or watching television. However, your peripheral or side vision will be restricted in the eye with the telescope implant. The effectiveness of the telescope implant has been demonstrated in clinical trials and FDA studies. An FDA study found that 9 out of 10 patients with the telescope implant improved vision by at least 2 lines on the eye chart. The most common risks of the telescope implantation surgery include inflammatory deposits or precipitates on the device and increased intraocular pressure. Significant adverse events include corneal edema, corneal decompensation, corneal transplant, and decrease in visual acuity. There is a risk that having the telescope implantation surgery could worsen your vision rather than improve it. Individual results may vary. Your healthcare provider can answer any questions you may have regarding the CentraSight treatment program or the telescope implant, and additional information can be found in the patient information booklet, which can be found at www.centrasight.com. The CentraSight treatment program can be an important step towards regaining your independence and improving your quality of life. If you or a loved one has AMD in both eyes that has advanced to end-stage AMD, please speak with your healthcare provider about the implantable telescope technology and CentraSight treatment program. It is possible to see more with your central vision and to reconnect you with things in life you love to see and do. Individual patient results may vary. Normal vision is not fully restored with the telescope implant, but patients can regain central vision and vision-related quality of life by varying levels. Not every patient may benefit from the telescope implant, and it may be contraindicated in some individuals. Please consult with your ophthalmologist to understand the potential risks of the telescope implant used in the CentraSight treatment program to determine if it may be right for you, or refer to the patient information booklet at www.centrasight.com. To learn more about the CentraSight treatment program, ask your doctor or visit www.centrasight.com.